All right, so in terms of dealing with lateral knee pain, right, and depending on where it is, how it pulls, in particular, when you start to get some pull to that lateral aspect of the patella, right, over to the side of that kneecap, there's a few things. One, obviously, there's probably is some type of mechanical reason, some type of movement that you were doing that maybe as a result of an acute issue, right, which 100% hard to always say regardless of what the situation is unless you have imaging done. But we tend to see a lot of that with that lateral movement or improper movement, kind of additional stress to that part of the knee. That also, because of the way the fibers are, and they kind of sit almost like a cobweb around the knee, also cause a lot of pull, especially in conjunction, again, if you're moving, or conjunction with the leg, if you're moving the leg, when you're moving laterally, even when you're going up and down, and you may notice it in a different motion than what actually causes it, which is always a little bit mind-boggling to people. But to address that lateral knee pain, what we're going to do, rolling pins work well. This is literally PVC pipe. If you have a stick, by all means, you can go with the actual stick, one of the marshmallow sticks or tiger tails or something of that nature. But we're going to go a little bit to the side. So here's my index finger on my right hand pointing to that kind of top corner of my patella. I'm going to work down from here, and I'm going to go up and down. Now, you want to get leverage on this, but you want to be in a relaxed muscle position. So you want to try to bend the leg a little bit to get a little bit of a stretch, but you don't want to be standing, right? You don't want a lot of like tension on it. You want to be able to try to get it to relax so you can put some pressure through and actually try to get some motion out of it. Now, even though people typically, and the same could be said for medial knee pain toward the inside of the knee, we still want to think the exact same thing. We want to work all of the fibers all the way around it, in particular in the upper leg, down through this kind of lower portion of the quad. Now, if you haven't already, before you even do that, make sure you roll the glute, roll the IT band, roll the quad, and then use a lacrosse ball or some type of deep soft tissue work for that glute on that side to be able to work through that before you even go to this. But this is something that's really easy. Now, rolling pin again works really, really well. If you find you have a knot somewhere, again, as we always say, you can kind of work around the outside edges to try to get it to release a little bit. Once you roll it, put pressure on it through this or rolling pin or whatever, then you want to go and do a nice gentle stretch. Now, if you're having fluid issues, swelling, patella pain, I would probably have you go standing and do something where you can take the pressure off of the knee if possible. You can prop your back foot up on like the arm of a chair or something like that, but just without having to put it down. Putting it down is probably going to lead to some additional stress just from having to move the kneecap around. So I would try to avoid that piece at first. But between the combination of working this and then that glute and hip and IT band quad, starting to slowly get that released, and then again going back to the movement, making sure you're driving home the right patterns in the right form, I would think you should start to see this probably subside. I'm going to say within a few days, I think 3 to 5 days, you'll notice an improvement. I would say within a week or two, you should notice that it's pretty much gone, at least 80 to 90% of the way, and then you can kind of creep forward going from there. So let me know if you have any questions. Hope this helps.